Good morning, everybody. Pleasingly, the New South Wales average for first doses is now over 74%, and we just encourage everybody to keep pushing for that. And in particular, in some of our hotspot local government areas, the first dose average is just amazing. Blacktown is over 85% first dose, Camden's over 86%, Campbelltown's over 82%, Parramatta's over 81%, Canterbury Bankstown's over 76% and Dubbo's over 77%. So we're really pleased with those results, and we just ask people to keep coming forward. And of course, our message is don't be left behind. Obviously, when these local government areas are in the high 80s and the state average is 74%, it means some areas in the state are falling behind, and we want to make sure we have targeted strategies in those communities. So don't be left behind when we start opening up, because when we open up at 70% double dose, it will be only for those who are vaccinated. So there's time now to get your first dose and then fit in your second dose before New South Wales starts opening up. And I just want to make that message as strong as possible. To 8 p.m. last night, we had 1,220 cases of community transmission, and regrettably 8 people lost their lives with COVID, and we extend our deepest condolences to them and their families. But we also appreciate that the best way to deal with the current outbreak is those high rates of vaccination. And I'm very pleased today to have with us Auntie Pauline de Weerd, who is the Executive Director of Aboriginal Health from St Vincent's, and she'll be speaking to us about the importance of our Indigenous community members as well as the wider community coming forward and getting tested. And she's one of the special people that takes care of people who have COVID, and will be sharing her experiences today and really encouraging people to come forward and get vaccinated. So Dr. Chant now will give her update, the Deputy Premier will talk about the regions, and then Auntie Pauline will talk to us about the work that she does and encourage those high rates of vaccination. Thank you.
There were 1,220 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were 2 overseas cases reported to 8 p.m. last night. 100,745 tests. Again, thank you to everyone coming forward for testing. There are currently 192 cases in ICU, 75 of whom require ventilation. They are across all age groups, so I again reiterate the fact that no one should be complacent about COVID. Please get vaccinated. Tragically, there were the death of 8 people who had COVID, and I pass on my sincere condolences to their loved ones. The death of a woman in her 70s from Western New South Wales at Dubbo Hospital was announced yesterday. She was not vaccinated. She had underlying health conditions. There was a gentleman in his 90s from southeastern Sydney died at St George Hospital, and he was not vaccinated and also had underlying health conditions. A man in his 50s from Nepean Blue Mountains died at Nepean Hospital, and he was also not vaccinated. A gentleman in his 90s from southwestern Sydney died at Campbelltown Hospital, and he was a resident of the Advantage Aged Care Facility at Preston's Lodge, and he had acquired his infection there. He was fully vaccinated. He had significant underlying conditions. And there was a woman in her 70s from southwestern Sydney died at Nepean Hospital, and she was not vaccinated. Again, she had significant underlying health conditions. A man in his 70s from southwestern Sydney died at Liverpool Hospital, and he was also not vaccinated. He had significant underlying health conditions. A man in his 80s from Western Sydney died at Westmead Hospital, and he was not vaccinated. He also had underlying health conditions. And a man in his 60s from Nepean Blue Mountains died at home, and he had 1 dose of the COVID vaccine. He had underlying health conditions, and the coroner is going to look into the circumstances around that death. And certainly additional advice will be provided in due course. I would like to call out the suburbs of concern. They are Guildford, Auburn, Marylands, Greenacre, Bankstown, Liverpool, Yagoona, Punchbowl, Dubbo, Bass Hill and Granville. But I'd also like to call out the Central Coast. We are seeing a number of cases increase in the Central Coast, so please come out and get tested. So tragically, whilst the Premier has announced that good achievement of the first dose coverage of quite a high level, when I look at the data, I still see many people over 70 unprotected. I still see many people in their over 50s that are unprotected. Please come forward and get your first and second dose as soon as possible. It is critical that you get vaccinated. You are most at risk of having hospitalisation and death associated with COVID. So please, can I just ask everyone to reach out to their loved ones, check that they've got a vaccine appointment and get vaccinated as soon as possible.